This is full access to Dr. Julien's operation room.
Good morning, Dr. Julien here. We're going to be performing a uterine artery embolization, which is a procedure we do where we stop the blood flow to the uterus to shrink down fibroid tumors. So instead of a big surgery like a hysterectomy or myomectomy, we just go through the bloodstream with a little tiny catheter through a needle puncture and inject tiny little particles into the uterine artery. This is the MRI that was performed. The lady has a whole bunch of fibroids, probably about 20 or so. Okay, so I need to get inside the artery so that we deliver our particles only to the blood vessel supplying the uterus. Okay, so this syringe is attached to my catheter, which the tip is in the left internal iliac, which is where the artery to the uterus comes off. And you can see that when I turn my catheter, the tip of the catheter moves, so I can direct on where to go. So we're done embolizing the left, so now it's time to go to the right side. So I'm pushing my catheter up, turning the tip so that it comes down. Now I want to hook into the internal iliac. These are our particles. You can see the little, mixing them there. You can see they're suspended. Okay, so here's the pelvis. This is the right side, that's the left side. The tip of my catheter is right here. It's that loop, and this is a picture I took moments ago. And it's moving quickly because the blood flow to the uterus is very quick. That's the uterine artery, that curvy, crazy looking artery there. And so now we're gonna start injecting some particles. On the right, we've already closed off the left. And you'll see as I inject my particles, they're mixed with X-ray dye. That's the only reason I can see them on my screen. And I'm gonna inject a whole bunch. And over the next few minutes, the blood flow will slow down a lot. Okay, we're all done. Just for review, through a little tiny needle puncture in the common femoral artery, we threaded our catheters into first the left and then the right uterine artery. We injected particles to stop the blood flow to the uterus. And so we're all complete with our procedure. The patient will be going to recovery, and after she gets situated, about 3 hours from now, she'll go home.
Find lasting relief from fibroids and get your life back. Contact us now.